Yeah, today we will demonstrate bite registration in less than 20 minutes. First thing, you should heat your wax rims. Wax occlusion rims should be softened, not melted. The water bath should be properly calibrated so that the wax only softens and doesn't melt. We need also to place, we need the casts, we need wax occlusion rims, tongue depressors. One of the tongue depressors has been used. We've used it already. We've put 2 dots on the nose and chin, and we've measured the vertical dimension at rests. We've measured the vertical dimension at rests. This is the vertical dimension at rest, the end of that point, the upper end of this point, and the lower end of that. To know, the water bath should be between 40 and 45 degrees. How to know that the wax is softened? You can press against it, and if it deforms, then it is soft enough for work. I'll keep it a little bit longer. Okay. I've also wet one of the tongue depressors so that it doesn't stick to the wax. I think it's now soft enough. First step is the adjustment or obtaining sufficient lip support, lip and cheek support. Again, if you're having less than 90 degrees nasolabial angle, you can easily press against the wax to provide more support. If you're having more than necessary lip support, here I've pushed the wax outside to provide more lip support for the patient. So now we're having sufficient support. This is the wet tongue depressor. عدل يا العشرة. Count to 10 please. Now we should decide on the incisal show. If it is more than required, you can press gently with the wet tongue depressor so that it goes to the appropriate position. Now we will adjust. طلع علي هون بضل. Look at me. My open eye. Okay. Now with tongue depressor so that it goes to the appropriate position. Now we will adjust. طلع علي هون بضل. Look at me. My open eye. Okay. Now we can adjust the orientation of the occlusal plane. Posteriorly should be parallel to the alatragus line. Other side. Again تعالي من هناك والله. تعالي من هنا. You should adjust it so that it is parallel to the alatragus line. Remember that the wax is soft and you can mold it, you can shape it the way you want. I'll check for one last time the interpupillary line, the alignment with the interpupillary line. Look at me, yes, thank you. Now the upper bite block is well adjusted. I'll cool it with cold water. We will open now retention grooves in the upper bite block. Heat a wax knife, then you can place your retention grooves or sealing grooves in the upper bite block. in the molar region. 1 or 2 V-shaped grooves on either side are sufficient and enough for this purpose. I've put some Vaseline on my hand. Now I'll paint the wax occlusion rim occlusally with the Vaseline so that it doesn't stick to the lower wax occlusion rim and allows easy separation.
أنا ببعت لك الفيديو اليوم، بعمل لك إياه وببعت لك.
Unfortunately, the lower wax rim was destroyed because the lower bite block wasn't fitting the ridge. So we opted to remove the wax rim altogether and replace it with a newly folded wax rim, lower wax rim. This will give us the privilege of having a thoroughly soft wax rim for the lower bite block. Remember that the wax rim should be very soft to allow us to obtain the appropriate vertical dimension and adjust the relationship of the upper and lower wax, as we'll see in a minute. You can do the same with the upper wax occlusion rim. You can take it out if you don't have thermostatically controlled water bath and resort to folding a new wax rim onto your base plate. So this is our new wax rim on the lower. You can do the same for the upper. But it is very soft. This is how soft it should be. This is how soft the wax rims should be for the upper and lower. The upper is still inside his mouth. I'll make sure this time that the lower fits over the ridge. عض والله شوي عض شد. افتح تمك. I'll just widen. افتح تمك أكثر. I'll just widen it a little bit. عض والله عض. ما تشد كثير. ما تشد إلا لما أقول لك. شوف هاي فك على بعض. شد أكثر. شد شوية صغيرة كمان خلاص. Now I've asked the patient to stop. We're having now 2 mm freeway space. عض والله شوية صغيرة. لا عض كمان أكثر شوي. شفايفك على بعض. ما تشد كثير شفايفك بس. We're now having 2 mm of freeway space. I'm not pressing against the skin. It is dangerous to press against the skin because this will give us a false recording. Now, while the wax is still hot, خليك عض. While the wax is still hot, we can adjust the horizontal relationship of the upper and lower wax occlusion rims. You can cut it and you can introduce it a little bit into the grooves, the upper grooves. Now remember that there is a slight overlap between the upper and lower. I'll cool it a little bit under running tap water. Assemble the bite blocks onto the casts. There is a heel contact between the casts now that prevents the full contact between the upper and lower wax occlusion rims. This should be corrected before dispatching to the laboratory and before proceeding with the selection of artificial teeth. Thank you.